Senator Specter, you, on the other hand, are a strong supporter of the public option. Could you support a final Democratic plan that does not include a public option?
I'm not prepared to recede at all. I think the public option is gaining momentum. We had a very forceful speech by President Obama yesterday on his Saturday talk show, emphasizing the importance of the robust public option to hold down the profits and bonuses. And I'm not going to step back a bit. I'm going to continue to fight for the robust public option. When I listen to what my friend Ken Conrad has said, those conditions which he articulated at the very end, I think, could be consistent with a robust public option.
You're talking, talking about, Senator Specter, either the trigger a couple of years down the line if the private health insurance companies don't provide affordable options, or the idea of state opt-ins. You're saying that those would be possible compromises you could support.
No, I'm not saying that at all. When Senator Conrad says he doesn't want a plan tied to Medicare reimbursements, you don't have to have a public option tied to Medicare reimbursements, so that when he is looking for conditions to protect his state, and I respect that, that's what I do for Pennsylvania, fight for my state, I think that that would be consistent with a public option.
Senator Specter, the other big issue is how we're going to pay for this. And a number of critics say that all the Democratic plans hide the real cost of health care reform. They point to a couple of things, that the plans would start raising taxes and fees in 2011, but the real programs wouldn't start till 2015. So you're raising money for 10 years, but you don't have the programs for the whole first 10 years. The other thing is that the Democratic plans call for hundreds of billions of dollars in Medicare cuts, and a lot of people doubt that this Congress or any Congress will ever have the will to impose those. Aren't these really just ways to dodge what the real cost of health care reform is?
Well, the Republican objections are wrong. President Obama has pledged not to sign a bill which adds to the deficit at all, and there are many savings. For example, the annual exams will cut down on chronic ailments which are so debilitating and expensive. We're going to have some tough criminal penalties, so people will go
Senator,
to
could you answer could you answer my question?
Well, I can if you give me a little time to do so, Chris. I'm answering your question that the plan will pay for itself, which is the Obama contention. Let me tell you why, if I can finish an answer, just a little here. One way is that the annual exams will cut down tremendous costs catching breast cancer, for example, at an early stage. Second, lifestyle changes, smoking and checking your cholesterol. Third, advanced directives. Fourth, criminal penalties to put Medicare fraud, Medicaid fraud in jail, so that there are specific savings which can be accompanied. Listen, on the Republican side, it is no, 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 a party of obstructionism. This is no longer the party of John Hines and Mac Mathias and Lowell Weicker. You have responsible Republicans who had been in the Senate, like Howard Baker and Bob Dole and Bill Frist, who say Republicans ought to cooperate. Well, they're not cooperating. Bob Dole reportedly wouldn't even return a telephone call from a Republican leader who wanted him to back off. Take a look at the absence of any Republican plan.